Hello friends, how are you? Hope you are all doing fine. So today's video is the sepsis. Sepsis is a very important topic, not only for CPC exam but also interview. In interviews also they will ask compulsory about what are the guidelines, ICD guidelines for sepsis, and also in the live coding. If you are a HCC coder, then sepsis will be you will be seeing this sepsis very frequently in your inpatient chats. So let's go through the ICD guidelines. So what is sepsis? First, we will start by knowing what is sepsis. So whenever the infective organism enters the body, then it is called as infection. So generally, this infection will be going away. If it is not treated, then in some cases it will build up in our body, and it will lead to sepsis. So this sepsis has three stages. First one is a sepsis. This from sepsis only it will be life threatening for our body, because this whenever we have infection in the body, the body's immune system will be reacting against the infection. But in some cases the body will be overreacting to the infection, and the body starts to send the infection fighting chemicals to entire body. So these chemicals will be attacking not only the infection but also healthy tissues along with the infection. So our tissues will be getting damaged, and it is a life threatening condition. So if in some cases this inflammatory chemicals will be damaging the organs also. So if the second stage is severe sepsis, where it is associated with organ failure. Whenever an organ is failed, then it will called as severe sepsis. And last part is the septic shock, where the multiple organs of our body will be failed, and it will lead to circulatory failure, and it may lead to death also. So this is the concept of sepsis. Next, so from here the guidelines. First, sepsis. If sepsis is given, then we have to code the underlying systemic infection. That means what is the organism that is causing the sepsis. So here is the example. If it is documented as sepsis due to E. coli, then we have to code A41.5L. First we have to lead the code through sepsis and E. coli. Then we will get this code. If the organism is not specified, then we have to code A41.9 if organism is not specified or unspecified. If the in the documentation it is given as only sepsis, then we have to code A41.9. If the organism also mentioned, then we have to lead through the organism. Next, second stage, severe sepsis. Severe sepsis R65.2 category should be coded when there is a documentation of severe sepsis or an associated organ failure with sepsis. So severe sepsis means sepsis with organ failure. This is the second stage of sepsis. So what are the codes we have to code? First we have to code the sepsis. If severe sepsis is documented, then we have to first code the sepsis. If the organism is given, then we have to code that. If organism is not specified, then we have to code A41.9. And second code is for severe sepsis. So R65.2 category. And if they're mentioned as respiratory failure or renal failure, for example, then we have to code that also. Acute renal failure, acute respiratory failure, then we have to code that code also along with these two codes. So if an organ failure is not associated with sepsis, then we can't code the severe sepsis. Then next, sequencing of severe sepsis. So when severe sepsis is present on admission, then it will become the sepsis unspecified will become the primary diagnosis, and next we have to code the severe sepsis code. If the severe sepsis is not present on admission, but during the hospital admission, if it developed during an encounter, then we have to code these severe sepsis as secondary diagnosis. For example, if the patient is admitted with some other condition, and after third day of admission, if he developed severe sepsis or sepsis, then we have to give this sepsis code as a secondary diagnosis, because the reason for admission is not sepsis. So next is the septic shock. Septic shock refers to circulatory failure associated with severe sepsis, means acute organ dysfunction. How we will code septic shock? First we have to code the underlying systemic infection, means sepsis. If sepsis is unspecified, A41.9 should be coded. Second code will be the severe sepsis with the septic shock. So this is the code for severe sepsis with septic shock. And if it is the post-procedural shock, then we have to code this code. And if any associated organ dysfunction is present, then we have to code that organ failure also. So septic shock, we will get these codes. First systemic infection, then severe septic shock code, then acute organ failure codes. This is the code for septic shock. Next, sepsis and severe sepsis with a localized infection. If the person is having some localized infection, that means in lungs like pneumonia, and further develop into systemic infection, that is sepsis or severe sepsis, then how will you code? So if the reason for admission is sepsis, severe sepsis and localized infection, when these are present during the admission, then we have to code first the systemic infection, that means the sepsis code A41.9. Then we have to the secondary codes will be the localized infection and severe sepsis, that means pneumonia and severe sepsis. If the during the admission, if he has only the localized infection, and after admission during the second or third day of admission, if he developed sepsis or severe sepsis, then the first code will be the localized infection, because the reason for admission will be the localized infection. He came to hospital because of localized infection. We have to code the localized infection as a primary diagnosis, and then secondary diagnosis as sepsis and severe sepsis. Next is sepsis due to post-procedural infection. If the patient had any surgery and after surgery the patient has developed any infection, how will you code? That infection lead to sepsis, then how will you code? First we have to code for the site of infection. So these are the codes. Depending upon the site of infection, the code range is this. We have to code the infection following procedure complication code. Then after that we have to code for the sepsis, because infection is then we have to code for the sepsis following procedure. Then we have to code what is the organism that is causing the sepsis. And next, if this is an infection case, if the patient is having post-procedural shock, then how will you code? If the post-procedural infection has resulted in post-procedural shock, so first infection came, then it turned into sepsis, then the sepsis lead to the multi-organ failure, circulatory failure, means that is called as post-procedural shock. So for that post-procedural shock, first we will code the sepsis following procedure, then we have to code the systemic infection, then we have to code the post-procedural shock. Here we will not code the normal septic shock code. We have to code post-procedural septic shock, because this code only indicates septic shock occurred after a procedure, after the patient underwent any surgery. So this is a post-procedural shock. This is the infection. Infection means these codes. Shock means these codes. Next, sepsis and severe sepsis associated with non-infectious process. So for example, if the patient has undergone a trauma, means like injury or burns, then the because of injury and burns he may develop infection, and further the infection is converted into systemic infection. Then how will you code? So depending upon which condition meets the criteria of principal diagnosis. If the patient came for trauma or injury, and after coming after admitting into hospital, if he developed sepsis, then we have to code first trauma, because the reason for admission is trauma. If this is one case, and if the patient had some injury and developed sepsis, after developing sepsis he came to hospital, then the sepsis will be the principal diagnosis, because for the reason for admission will be the sepsis. Because of sepsis he came to hospital, that's why the sepsis will be the principal diagnosis. Hope you like this video. Thank you for watching this video. Please subscribe to my channel and share the video with your friends.